One very common thing we see within our practice is the loss of the normal curve within a neck, or what we call the cervical spine. And there is a device or an orthotic. There's several different kinds out there. The one that we use in our office because of its comfort level, and again, the patients, it's really it comes down to people using things consistently and being compliant with them. And we've used different orthotics in the practice. This orthotic is comfortable and people will use it. It's also customizable that you can adjust some of the heights on it. So Dr. Ratcliffe, can you explain a little bit about how that's used and how it benefits patients?
Yeah, absolutely. So this particular neck roll, typically when you start treatment plan, specifically if you have something going on in your cervical spine, we like to introduce this maybe 6 to 8 visits in. We don't like to do it right away because we're going through so many different motions, getting segments adjusted, trying to relax the paraspinal muscles. So maybe 6 to 8 visits in, you'll actually sit down with our functional fitness specialist and they will go through where the placement needs to be based off of your x-rays in your neck and cervical spine to help try to bring some of that cervical curve back. And so they'll walk you through that step by step. We have an instructional guide that you can take home. And so the biggest thing with that is placement. We need the right height. It needs to be on a specific segment in the neck. Everybody will be different. So for some people that apex needs to be maybe around C3, others maybe a little bit lower like C4 or C5. So placement is really huge, and the functional fitness specialist will go over that with you. And the biggest thing from there is just making sure that you increase time accordingly. So
basically, it's a home traction device.
Exactly.
You're using gravity and on the way to the head to traction the spine and to basically stretch the ligaments and the supporting tissue around there to help restructuring and ultimately restoring proper function.
Yeah, and that's such a big thing right now because, most people, for us as chiropractors, we're over patients all day long. So this happens to us as well, but you have people at the computer all the time in the seated position, forward, head posture, rounded shoulders. And the big thing is with the upcoming generation, with how much time they spend on social media and devices. And so we're actually getting these on our pediatric patients to try to curb some of the dysfunction in the spine as they get older.
Just another piece of that comprehensive care at Woodlands Family Chiropractic.